It's another bright day, and we welcome all of you to the Health Bars on Big Hands TV. We are continuing to make informed decisions in order to optimize our health. I'm your regular host and presenter, Michael Jamil Say, and today we are going to be talking about pain and pain management. Have you ever felt any severe pain? How was the pain relieved? What were some of the measures you took in order to relieve the pain? These and many more are the questions we are going to discuss today. Our resource person is ready, but before I introduce her, we are going for a quick commercial. We'll be right back. Please stay tuned. This is the Health Bars on Big Hands TV. Welcome back, our lovely viewers, to the Health Bars on Big Hands TV. Like I said before our commercial, today we are discussing pain and pain management. We want to thoroughly look at how we will be able to manage our pain the appropriate way. A lot of times people suffer various episodes of pain and they take chances into their own hands and they do a whole lot of things that in the end up complicating the pain they have. Today we are very glad that we have in our studios Dr. Emefa Jede. She is a medical officer at Weije Agbawe Municipal Hospital, and she will be taking us through our discussions today. So help me welcome Doctor to our studios. Yeah, welcome, Doctor.
Thank you.
All right, it's good to have you.
It's good to be here.
All right. So right away we'll move into our discussion, and we want to ask what pain is. What pain is? What is pain, Doctor?
Okay, pain is defined as an unpleasant sensory and emotional experience, which is usually but not always associated with potential or actual tissue damage, and it can be described in terms of tissue damage, but generally it's a subjective and personal thing.
Okay.
And it's an unpleasant experience in general.
Okay.
Yeah.
So it's something that is always unpleasant.
Yes.
All right. Now, what could cause pain? What could cause pain?
Well, as I said, it's usually from tissue damage.
Okay.
So I like to think of pain as like an alarm system or a warning system from the body. Okay. So it tells you when there's something wrong going somewhere, where some tissue is being damaged, is being destroyed, or it's being stressed in let's say a negative sense that could lead to damage.
Okay.
Yeah.
All right. So anything that occurs in the body that sort of stresses the system would give us pain.
Yes.
Oh, okay. Okay. Now, are there sometimes you hear people when they come to the hospital where you work, where I work, they would say, the pain I have in my knee, it's kept so long. It's not relieving. I have taken this drug. I've taken that drug. What may be causing some pains to be short-lived, or they will be relieved in a short period of time, but other pain, I mean, the person can live with the pain or something like that?
Well, it all depends on the mechanism of the injury or how it is being caused. There is some pain that is just caused by maybe like a physical stress. Maybe you hit your leg against a stone, you feel the pain. So that one, once that collision or that how do they call it? Once that interaction is over, the pain will start to be relieved, unless maybe the tissue is damaged, a wound has been created. So when the wound is healed, then the pain is relieved. But in certain cases, there could be inflammation. Okay, especially in the elderly, they have this kind of arthritis. They can have osteoarthritis, and sometimes they have rheumatoid arthritis, and so the inflammation remains. That is, the area is constantly, should I say, under stress.
Okay.
Okay, because of certain chemical processes that are going on. The immune system is trying to fight, and then it's causing for increased blood flow and release of certain biochemicals, which may also cause pain.
Okay.
So in those cases, the pain can be prolonged until you find a way to stop that inflammatory process that is going on. Sometimes too, the pain is short-lived if it's something that is just transient or it's easily treatable.
Oh, okay. Okay. So, do we have any classes of pain or types of pain?
Okay. With pain, some say 3 types, some say 4 types. I would say 4 types of pain.
All
We
right.
have the nociceptive pain. That's from the direct result of tissue injury. Okay, usually from a mechanical injury or maybe from a cut.
Okay.
Okay, so that's the nociceptive pain. Then we have the inflammatory pain, which is an abnormal inflammation. Inflammation usually it comes and then it goes, but with the inflammatory pain, the inflammation persists. So in something like rheumatoid arthritis.
Yeah, you mentioned rheumatoid arthritis earlier. Please, can you, explain it a little for our viewers, please?
It's an autoimmune condition. It's a condition whereby the body's immune system is fighting against the body's own tissues.
Okay. All right.
So there is no problem. Like usually if there is, let's say, an infection,
okay,
the biochemicals will go there to try and then neutralize the infection, and then they produce those chemicals and then they lead to the pain. But in the case of an autoimmune disease, there is no actual attack going on there. There's no actual problem going on there, but the body is presenting a reaction as if there is an injury or as if there is an attack at that point. So it will send the biochemicals there and then try to at least fight whatever off. Meanwhile, there's nothing to fight off, so it just continues the process, and then you continue to have the effects of the pain.
All right. Okay. So you were talking about nociceptive pain.
Yes. That's the first one I mentioned.
Yeah.
Yes, that's from the direct tissue injury.
Okay.
Yes. So then we have neuropathic pain.
Okay.
Which is from the nerves actually being damaged or irritated. Yes. Okay. So normally the nerves would be the ones to send. The nerves have receptors. When they receive the signals, then they translate it into pain. But there can be a case where the receptors are not being triggered, but the nerve itself is irritated or the nerve itself is damaged. So it is transmitting that sensation as pain to the person. So this happens when you have certain metabolic conditions like maybe diabetes, and then it affects the nerves. Okay, so if your diabetes is not well treated or is not treated at all, it can lead to this damage to the nerves, and then you will be having these pains in different parts of the bodies, especially in the extremities. Okay, the hands and then the feet.
Okay.
So that's neuropathic pain. It can also be caused from maybe some viral infections as well. Some viral infections affect specifically the nerves.
Oh, okay.
Okay, yeah. And then we have functional pain.
Wow.
Functional pain, that's a little bit not too common. And it's the pain where you don't really see the origin. You can't really pinpoint that this is what is happening in the tissue or this is what is happening in the nerve. But there is pain. The patient is feeling pain. That's in a condition like fibromyalgia or irritable bowel syndrome. They are not very common in our part of the world anyway, but it's something that happens to people. It's quite rare, but it happens. So you might the doctors might not be able to find anything wrong, no inflammation, nothing, but then they still
pain.
see the pain. Yeah.
Wow. Okay.
So those are mainly the 4 types of pain. But with the nociceptive pain, we can divide it into somatic and visceral pain. Somatic is more of the skin, muscles, joints, and then the visceral pain is more of the internal organs. So the somatic pain is like cramping, aching, and it's localized to a particular area depending on like the extent of the injury. So if maybe you twist your elbow or you twist your ankle or something like that, that kind of pain you feel is the somatic pain. But with the visceral pain, that's one, it's usually more like squeezing, a pressure and aching, and it's not always localized to one particular area.
Okay.
So you'll be like, you feel the pain all over here, you can't really tell where, or you feel like it's in the upper section and stuff like that. So in those cases, it's usually the internal organs, the gastrointestinal tract, your kidneys, your liver. So when you have pains in those organs, yeah, then that would be a visceral pain.
Oh, okay. So those are the 4 classes or types of pain. That's very, very extensive. Please, why is it important that people assess pain when they have any sensation? Why do you think it's important we do so?
Well, let me get your question right. Do you mean like how they grade their pain?
Yeah.
Oh, okay. Well, it's very important because it's the pain, as I said, is an alarm system. So depending on whether the pain is increasing or the pain is decreasing, it will tell you whether the condition is getting worse or is getting better.
Oh, okay.
Yes. So in most cases, when the pain is increasing, it means that the damage is actually getting worse. Okay, because sometimes the pain starts to warn you of an impending tissue damage, and then if you don't do anything about it, the pain increases. Something like appendicitis. Okay, it might start as just a little pain here, you don't mind it. Tomorrow a little pain here, you don't mind it. So after some weeks, you realize now that the pain is getting more and more severe. That means the damage is getting worse. And then sometimes if it gets too severe, that means it could even cause a rupture of the appendix.
Oh, okay.
Yeah. Okay. So you have to know the pain. And normally in the hospital, what we do is we ask you to grade your pain from 0 to 10, where 0 is no pain and 10 is the greatest pain you've ever felt in your life. And you grade and then you try and then see how it is. Normally we do that with a sickle cell patients to assess how they are improving or how they are getting better with their sickle cell crisis, the pain crisis that they have.
Oh, all right. A lot of times we hear about myths. People believe when you are even bathing, you shouldn't sink. Because when you sing, your mother may pass. Yes, those things. Are there any myths about pain?
Oh, there are quite a few. Okay.
So would you like to share some of them with us?
Okay. Well, there is this one about no pain, no gain, especially with the bodybuilders. When they are trying to build muscles and they are lifting weights and all those things, they believe that you have to exercise and do it until you feel the pain before you know that you are actually doing it. But that's not actually true, because if you are someone who doesn't exercise regularly and then you exercise, yes, you might feel pain. But if you're someone who exercises regularly on a weekly basis, like 2, 3 times a week, you shouldn't be feeling pain every time you exercise. So that means you are straining the muscles and then you are causing some damage.
Okay.
Yeah, so that's one thing. But there's an exception to this rule.
Okay.
Because In cases of chronic pain, where there is a need for physiotherapy,
Okay.
so that's the only exercise that you will do that you might feel pain, but you have to continue doing the exercise because it will help to gain mobility of the joints that you are working on. But aside that kind of pain, normally you shouldn't be feeling pain if you are doing your regular exercising.
Oh, okay. Okay.
Okay, another one is that only weak people go to hospital because of pain. Especially they'll say a real man should be able to endure pain. So he should keep quiet and then take the pain like that.
Really?
Yes. So that's why we get a lot of males come into the hospital quite late when the pain has exacerbated, like has become very, very severe, and then the complications have occurred. Okay, so someone might have a leg swelling and then he wouldn't bring it to the hospital. He will be feeling a little pain. He won't bring it to the hospital. When the pain gets very severe, then he will come to the hospital. Then you realize that the infection in the leg has spread and is now in the blood and it's a whole systemic infection. Yes, so...
And that can even kill, I guess.
Yes, it can even kill you if you don't seek attention. So don't try to always endure pain. Okay, once you feel the pain and it's persistent, once the pain is not going away, please report to a hospital and then let them have a look at you and find out the cause of the pain.
Okay.
And there's another one that says you will get addicted to pain medications if you take it more than once.
That's an interesting one.
Yes, so people get worried when you put them on pain medication. They get worried and say, oh doc, won't I get addicted? I don't want to get addicted. Okay, and with that there are two sides to it. First of all, there are some classes of drugs that are addictive, some classes of pain medications that are addictive. Okay, but there are some over-the-counter medications, over-the-counter because you can easily just purchase them, which are not addictive. Something like paracetamol, it's not addictive. You can take it for 5 days, 6 days, you are fine. Okay, you just have to make sure you take it in the right dosage. Okay, because too much of everything is bad anyway. But aspirin, diclofenac, they are all not, ibuprofen, what we call brufen. They are all not addictive. But we have the opioids, the morphine, pethidine, oxycodone. Those ones, if you are on them for a longer period of time, you can get addicted. Not that you definitely will get addicted. Addiction is kind of like if you have a predisposition to it. It's not everybody who will get addicted. That's how come not everybody who drinks alcohol is an alcoholic. Okay, you have a predisposition to it. So if you do have that predisposition to it, you might get addicted if you are on it for a prolonged period of time, like let's say 2 weeks or more. Okay. But generally, if you are on those kind of medications, they are prescription medications, so they should be supervised by a health professional. You shouldn't just be, you can't go to a pharmacy and buy opioids by yourself like that. You need a prescription.
All right, so that's very extensive on the myths about pain. So dear ones out there, the fact that you are able to endure pain as a man doesn't necessarily mean you are a man better than another person. No. Whenever you have the sensation of pain, please, you are being encouraged to visit the hospital for more definitive treatment. This is the Health Buzz on Big Hands TV. We are discussing pain and pain management. We have in our studios today Dr. Emefa Jede. She is a medical doctor at Weijagbawe Municipal Hospital. She is taking us through the discussion today. We are going for a quick commercial. We'll be right back. Do stay tuned. Welcome back, our lovely viewers. I'm your regular host and presenter, Michael Jamiose, and this is the Health Buzz on Big Hands TV. Please follow, like, and subscribe to all our social media handles on Facebook, YouTube, Instagram, and Twitter. We are discussing pain and pain management. A lot of times we all want to manage our pain how we think it's possible for us. But today we have Doctor in the studios and she's taking us through. So before we went for the commercial, we had discussed the various types of pain. I hope you remember one of them. Please be attentive as we go on to the discussion. So doctor, please, we'll take it from chronic and acute pain. Chronic and acute pain. Because when you were discussing the types of pain, you didn't come up with that. So I want you to explain to all of us if there's actually a type of pain that can be classified as chronic or acute.
Okay. Yes. Pain, you can classify it with respect to the duration, how long it lasts. Okay, so acute pain is usually less than 2 weeks duration. Okay. So the pain has to resolve, or it has to go within 2 weeks. If it's more than 2 weeks, 1 month, 6 weeks, 2 months, then it becomes a chronic pain. Okay. So it's a pain that keeps coming back even after trying to manage it. Okay, it keeps coming back. That's a chronic pain. Okay, and it depends on what is causing the chronic pain. Sometimes it could be disease conditions. It could be cancer or something like very severe like that. Or it could also be an autoimmune condition, as I explained, like the arthritis, as I mentioned earlier. Yes, so especially in the elderly, they tend to develop these conditions, especially probably with their spine and all those things. So there's some misalignment there, and then that would lead to pain, which is persistent. So they'll take medication today, then tomorrow the pain is back. They take medication, then the next day the pain is back. That's chronic pain. So that one, it has a way that it is handled. And then acute pain has a way that it is handled. With acute pain, you basically want to just take care of the cause at the roots of it, and then the pain itself will resolve. Okay, but in certain cases, in cases of chronic pain, you can't exactly fix the root cause. That is not that simple to fix. So it keeps recurring, and then the patient has pain for a prolonged period of time.
Wow. I would like to ask this: is chronic pain usual with the elderly?
No, it's not. It's not usual.
Okay.
It's not normal.
Okay.
It is just that elderly people are at a higher risk of developing those kinds of conditions, the arthritis, and especially the females with the decrease in bone density and all those things. Yes. So they will develop those kind of pains in the bones. But it is not necessarily that every person, by all means, by the time you are 60, 70 years, you have to have chronic pain. No.
Okay.
But generally in aging, there is always some aches and pains here and there. But normally they shouldn't last. So if you're having a pain that is lasting for months, then you should know that that's a pain that needs some medical attention.
Sure. All right. Now, growing up, I remember when you step on a nail and you get injured, your parents would tell you, go and step on a stone they've placed in fire, so that the pain will go, doctor. And indeed, it worked. I remember, yeah. I want to ask, what are some of the inappropriate ways of managing pain? I mean, once you think would actually worsen our pain experience if we go that way when we are having any pain experience.
Well, it usually depends on the pain, the cause of the pain.
Okay. Yes. So let's take, for example, someone has headache, head pain. What do you think are some of the inappropriate ways of managing headache?
interesting.
Yeah.
Inappropriate ways of managing headache.
I mean, something someone will do that would worsen the headache if there are any.
To be honest, people do a lot of different things, and I've heard of people drinking strong alcohol.
Wow, to clear headache.
Yes.
Wow.
But generally, headache is something that normally most people would just go to a pharmacy and then get medication, or they will drink water and they will sleep. But depending on the cause of the headache, so if it's being caused by something like malaria, you might take paracetamol and it will go.
Okay.
But it will reoccur once the paracetamol action wears off, because that is not the cause of the pain.
Yeah.
Yes. So once you have to tackle the cause of the pain, and then you go from there. So like what you mentioned, stepping on a nail, stepping on something.
I'm sure producer may have also done some when he was young.
You see, so generally what that does is you actually burn that area, and you deactivate the receptors, the pain receptors at that site. So you're actually damaging the tissue further and then damaging the nerve endings.
Is that helpful?
No, it's not.
Because there's a movie I watched, The Last Ship. When the captain got injured, he jumped off the aeroplane, the Air Force One. And I think somehow he could light fire. And he picked the stone, placed it in. When it was heated, he placed it there like that. I think he was applying the same thing there.
No, you see, that was probably in it, trying to prevent infection.
Okay.
Yes, and in the olden days when we didn't have modern medicines, they used to treat wounds with like a hot knife or something, and then cut off the dead tissue or burn off the dead tissue around the area of the injury. So that was a way of sterilizing a wound.
I see.
Yes, but now we are way past that. We don't need to do that to sterilize the wound. We have so many chemicals and drugs that we can use to sterilize the area. And if we need surgical intervention, we can use some surgical means to try and then peel off or remove the infected parts of the wound or the tissue, and then we then put the medications on.
Okay. Some people describe their experience of pain as relieving with time. Others too also may describe their own as the pain worsens with time. What do you think are some of the factors that may cause a pain to be relieved or worsen? Because sometimes at the hospital, doctor, me dam in sabunkum so na eyemeya metnasia na eyemeya, those things. Okay.
Let me go into what we call the characteristics of pain.
Okay.
Okay. So it's these descriptions tell you the nature of the pain. So you have the site of the pain, the time of onset of the pain. Sometimes the pain comes in the mornings.
Yeah.
Or it comes in the evenings. That's usually with certain infections. Okay. Then you have not the severity, as in the nature of the pain. Sometimes it's like, as I mentioned, it can be squeezing in nature, or it can be sharp, or it can be like a stabbing nature, or
in it's a thrombin or nauseating pain.
Yes. Different people would describe different kinds of pain. We have even the one where the abdominal pain, where they feel the pain and then it stops, then it comes back, then it stops, then it comes back, then it stops. That's what we call colicky pain.
Yeah.
Yes. So
I like that name. Colicky pain.
Yes. So depending on the cause of the pain, that would determine what is going on. And increasing of the pain with position, it depends on the type of injury that has occurred. Because if maybe there is a fracture,
Okay.
moving the arm, the fracture site, will cause a lot of pain. But if you keep it still, so if you put any pressure on that aspect, okay, maybe you raise this, because this muscle are attached to this bone, and when you do this, it will shift the bone, so you feel pain. So you realize that when you stay still, it feels better, but when you move, so it could be that there could be various types of injuries in different parts of the body when there is pressure applied to that side. So maybe when the person lies on one side, he feels more pain. When he lies on the other side, the pain is relieved. So it depends on the cause of the pain.
Okay.
In the sense, so that we know how the characteristics of the pain would be like.
Okay. Is it true some people deny painful experience?
Deny painful experience?
Yes. As in, we have learned that the facial expression of people, their countenance can actually tell you they may be going through a pain experience. And sometimes it is clinically observed. You see that this person has pain, but when you ask the person will say, no, I don't feel pain. Do they think it's weakness or something like that?
Depends on the person's pain threshold.
Okay.
So the pain threshold is the how severe a pain is before the person would detect it physically. Okay, so for instance, if we take like a needle, okay, and then we just tap, okay, if you tap me and then I tap you, it might be the same pressure I used to tap, but I would be like, Ajay, 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 and I'll start crying, and then you'll be like, was it painful? Oh, nah. Okay, it's your pain threshold, how easily you feel the severity of the pain. So some people's pain thresholds are not so wide. So you might see physically, maybe when you press their abdomen, they might move. When you ask them if it's painful, they'll tell you no. But if it was another person, the person won't even allow you to touch. The person will be holding your hand away from them. Okay. So it's actually it's more subjective in that sense.
Okay.
Yes.
Now, our cultures, culture, how the way of life of people, and maybe some personal experiences, do they affect pain threshold?
Yes, they do. You see, as I mentioned, pain is not just sensory, but it's also emotional. Okay.
Wow.
It's also associated with a feeling. Okay, so
As in when a beloved breaks someone's heart.
Something like that. Okay, when you associate the severity of the pain with something, okay, when you see that thing, it will make you, I don't know how to put it, you feel, you have a higher sensation of the pain. Like, let's say with someone who you want to give an IV medication. Okay, some will tell you that, oh, this IV medication is very painful, but if the patient is not paying attention and then you just give it the same one, or you tell the patient, oh, no, this one is just water, and you just give it to the patient won't feel any pain. Okay, because he's associating it that, no, the last time they gave me this medication, it was very painful. So when you say, I'm coming to give you this medication, then they feel like, So sometimes they associate the pain with certain things, and maybe they associate the pain with certain situations, maybe being in a hospital. So someone might get stabbed at home, he might not have so much pain, but if you are giving him an injection in the hospital, he'll be screaming in pain, just because the scenery or the place where he finds himself is actually influencing his the way he perceives the pain.
Right. It's getting very educative in here. This is the Health Bars on Big Hands TV, and your description or definition for a particular painful experience is definitely based on your definition for your pain threshold. This is the Health Bars on Big Hands TV. Please like, subscribe, and follow our channel on YouTube, Facebook, Instagram, and Twitter. We are discussing pain and pain management. I'm your regular host and presenter, Michael. We are in the studios today with Dr. MFA Jede. She is a medical officer at Wejagbawe Municipal Hospital. We are going for a quick commercial. We'll be right back. Please stay with us. Welcome back once again, and we are still here and we are discussing about pain and pain management. You've known that nociceptive pain is a type of pain, and sometimes you can be feeling the pain sensation, but we may not be finding any actual cause, and that is a functional pain. We are still here with Doctor, and we want to ask her to explain to us if all painful experiences are treatable. If all pain experiences are treatable.
Okay. Well, I'm not a pain specialist, so I'm afraid to answer this question, because from my experience, I would say not all pain. Okay, but it depends, because it's not my area of specialty. I can't say. But generally, most pain, we have ways around them, how to manage them. Yeah, depending on the cause of the pain, then we know what we can do to try and then alleviate the pain.
Okay. So what are some of the first aids people can take? I mean, we can all employ when we have any type of pain. What are some of the first aids?
Okay. You see, pain has many different causes. Pain can be any part of your body.
Okay.
So let me talk about, let's say, muscle and joint injuries. Okay, if maybe you are playing
then
football
I think if you could, like you just said, maybe you talk about headache, then you tell us some of the first aids we can.
Yeah.
Muscle and that would be very helpful. So please, you can go on.
So you want me to start with headache?
No, it's fine if you start with muscle and joints.
Okay, let me start with muscle and joints, because that one is simpler for me.
All right.
Okay, so that one, if you are just playing a sport and you get injured, as in you twist a joint or something like that, or you strain a muscle, okay, what you do is what we call RICE. That is rest, ice, compression, and elevation. So you rest that leg. You don't continue playing with that leg once you've strained a muscle in the leg. You rest, and then you apply ice. You apply the ice for about 20 minutes, and then compression. You can get a bandage and then wrap it around it, and then elevation. You keep that side elevated, so you keep that leg elevated. You don't stand on it. You sit and then you prop it up on a cushion or a table or something.
So you just raise it?
You just raise it.
Okay.
Yes. So you can continue icing it every, I think, 6 hours or 4 to 6 hours. You can ice it and then see. But if you try doing that and then the pain is still persisting, then I would advise you to go to see a medical officer and then try and then see if there's any like severe damage that has been caused other than just a strain or just a twisting of the muscle. All right, so for something like headaches, you could usually take paracetamol. That's everybody. People look down on paracetamol, but paracetamol, it really works.
Wow.
It really works, and it's really helpful because it's appropriate for both the young and the old, and they can take it. But the other classes of the pain medication, that's the over-the-counter medications, we have the NSAID, non-steroidal anti-inflammatory drugs. We have something like aspirin. Aspirin should be avoided in children.
Can you be very loud on that? Yes.
Aspirin should be avoided in children. Never give a child aspirin, because aspirin in children can cause a severe reaction, okay, which can even risk the child's life.
Okay, doctor, that's very important. People may define children differently, so maybe if there's a particular age bracket you want to mention.
Well, it usually affects 6 years and below, but I think to be on the safe side, 12 years and below.
12 years and below.
12
aspirin
years
should
and
be
below.
avoided.
Yes.
All right.
Yes. So you avoid aspirin.
All right.
Okay. And then there's diclofenac and ibuprofen. And we have the combination drugs. We have the one that combines paracetamol and brufen. Some combine paracetamol and diclofenac. Some combine paracetamol, aspirin, and codeine.
Wow.
Yes, so there are different brand
combination.
names. Yes, none of them is sponsoring me, so I won't mention any of the names.
I like that. So, like Doctor has said, if you want your products to be mentioned, please come and sponsor the Health Bars on Big Hands TV. Yeah, that's very smart on your part. Yeah.
Yes. Okay. But taking these NSAIDs too often can have effects on your stomach. It can affect the stomach lining and may cause ulcers. So if you are someone who is always working and getting these body pains, and every time you are taking these NSAIDs, aspirin, diclofenac, or those combination drugs, if you keep taking them, you could actually affect the lining of your abdomen, of your stomach. Sorry. So once you do that, it can lead to stomach ulcer.
Very well. Okay. Viewers, abusing these NSAIDs can lead to irritations in the lining of your stomach, and you may risk an ulcer. Please be informed, doctor.
Yes. Also, what other pain?
We've talked about headache, we've talked about muscle and joint, so...
Okay, so probably stomach ache is the next commonest thing. For stomach aches, we generally just take antacids. That's the over-the-counter drugs that we can take. So antacids, like the aluminum hydroxide or magnesium trisilicate. Some are also a combination of the two drugs. Some have even additional anesthetic agents added to them. Yes, to relieve the pain. So yes, so you can get any of the over-the-counter antacids for stomach aches. But if the pain is very severe, I would advise you just go straight to a doctor, okay, or to a hospital to be examined and treated. Okay, don't go and buy antacids for a severe pain. Or if the pain is colicky in nature, then antacids are not going to help. It's more the colicky pain is more due to spasms of the muscle, what we call the smooth muscle in the body. That's the muscle that forms the internal organs. Yes, so when there is spasms there, so your gastrointestinal tract, your urinary tract, so those places, when there's spasms, they cause pain. And that's one we don't necessarily treat with pain medication. We can, but preferably would want to treat with antispasmodics, but those are prescription drugs. So you have to go to a hospital and get a prescription.
Finally, we would want you to take abdominal pain, maybe for our ladies.
menstrual
Yeah,
pains.
yeah.
Menstrual pains, you can use the NSAIDs as well, depending on the severity of the pain. You can use NSAIDs. Sometimes paracetamol can do the trick for you.
Okay.
Okay. Sometimes the combination drugs, paracetamol together with diclofenac, can help you out. But sometimes if it's not helping, we can try some antispasmodics, because sometimes the pain in the menstrual pain is caused by spasms within the uterus, trying to expel the dead tissue and the blood. So you can try antispasmodics, but those definitely you have to go to a hospital and get them. So you can just try your NSAIDs. If the NSAIDs are not working, go to the hospital and then get a full workup. Sometimes there could be an infection or something that may be causing the menstrual pain to be so severe. So you have to go and then get checked out. So yeah.
All right. So what are the effects of untreated pain? I have headache. You don't go to the hospital. I have headache. You don't go, and the pain persists. What will be some of the effects of you not treating it?
Okay. As I said, pain is an alarm system. Okay. So if you don't listen to the alarm, then something is going to happen. Because if you have a fire alarm and you don't listen to the alarm, your house will burn down. Okay. So with pain, depending on where it's being is affected, which part of the body is affected, sometimes the pain might come as a sign of imminent tissue damage.
Yeah.
And you don't do anything about it, then it goes on to tissue damage, and then you might end up losing a vital organ because of not responding or not attending to the pain. Okay, that's why in certain conditions when they don't feel pain, it's very dangerous. Like in the diabetics, when they lose sensation of pain in their feet, yes, then you realize that they lose their toes and things. Okay, they get hurt, they don't feel any pain, and then the toe gets should I say decayed, or it dies off and then it comes off. Okay, so you end up losing parts of your body because you didn't attend to the pain. So if you actually don't have such a condition and you feel the pain, it's best to attend to it. If you get a headache and then you take paracetamol, it goes and then it comes back again, and then no, maybe there is something else behind it.
Okay.
Yes.
Okay.
So once you are feeling a pain and you take your first aid and still it's persisting, please go to a hospital and get checked out.
Okay. So finally, chronic pain, can it lead to shock?
Shock. In what sense of the word? In the medical sense of the word?
Yes. As in the person going off.
Oh, okay. Severe pain can lead into shock, okay, because pain increases the heart rate. It has this sympathetic. Let me put it in a more understandable way.
Yes.
Okay, so it makes the body go into overdrive. So your heart rate will go up, your blood pressure can go up. So all that, it can lead to you fainting and things like that. But generally chronic pain does not.
Okay.
But chronic pain, what it does, if you don't manage the chronic pain, it can cause difficulty in sleep. It can even cause depression. Okay. And it can affect your ability to go about your everyday activities. Yes, but chronic pain in itself does not necessarily cause shock or cause you to lose consciousness or anything like that. Okay.
So it is very imperative that aspirin is avoided in children below the ages of 12. We shouldn't risk their lives by giving them aspirin. This has been another educating and exciting episode of the Health Buzz on Big Hands TV. We were joined in the studios by Dr. Emefa Jide. She is at Wejagbawe Municipal Hospital. She's a medical officer there. Now, before we wrap up, we'll take her final words. Doctor, your final words to our viewers, please.
My final words.
Yeah.
Okay.
And if you have any regards, you could give to,
All right, my final words would just be, pain is a warning system and it's not to be ignored. Okay, so once you have pain, maybe you might know the cause. Maybe you haven't eaten all day and your tummy is hurting or your head is aching. Yes, then you know that you have to eat or do something, and then it will relieve the pain because you are getting it at the root cause. But when you don't know the root cause, paracetamol, painkillers, they are not the cure to any illness. They just take care of the pain. So once you are having a pain which keeps coming back, then you have to go to the hospital and get checked out, do some lab tests, and let's find out what the problem is. And don't just be treating with paracetamol, because you might be making the actual disease condition progress. Okay.
All right. Thank you so much, Dr. Emefa Jide, for making time of your busy schedule and coming to educate and teach us. Well, viewers, all too soon we have come to the end of our discussions today. But before we leave you, I would like to remind you that we are able to come your way by the kindness courtesy of Big Hands Travel and Tour and Big Hands Foundation. You can find these two institutions off the Kaswa Highway, off the Professor J.A. Mills bypass. You can find them there and get in touch with them. They will get you covered for your traveling, and they will also get you covered for any charity you want to give to the society and the public. We will come your way same time very soon, and it would be another exciting episode as well. I have been your regular host and presenter, Michael Jamiose. Please like, subscribe, and share our videos with all other persons who matter. Take care of yourself and continue to make informed decisions and choices about your health, because health is the first form of wealth. I would want to give my regards to Mrs. Satanso, Military Hospital, and also to my spiritual father, Reverend Speaks Gate of Global Revival Ministries. Thank you for watching, and bye for now.